The following is a presentation of the Healthcare Facilities Network. So what is stage two? What is stage two saying right there?
Well, through the 100+ hospitals and detailed discussions, another couple of quick points is that we can now look at what the FTE ratio is per staff bed or per operating bed and see how close that is. Another item I've found is that there are 4 primary skills that are very consistent throughout the industry, and that is the general techs, the general mechanics, the HVAC techs, third is the electricians, and then fourth are the plumbers. I found a strong alignment between all the other campuses and how they handle the primary skills, separate from what I call the specialists. And that would entail for instance, the stationary engineers, where again, one facility may have a central plant, where another facility doesn't have one. They just buy energy. Well, so that's a big swag in terms of that area. I found painters to be another big swag, where some folks will have 2 painters, other folks will have 12 painters, just based upon, well, we want to paint our buildings every year instead of every 3rd year. So that was a big revelation to me in terms of how those 4 primary skills are being organized.
The 4 primary skill sets that you're talking about, correct? Right here in the middle?
That's right.
So yeah.
What I'm showing here, maintenance and support will be in the 10 to 15% of the total department, leaving us 85 to 90% of the working folks doing work orders. And that breakdown is very consistent throughout the country. Of about 27% are the general maintenance mechanics, HVAC is about 16, electricians 13, plumbers 12. Another interesting point is that the 4 primaries will represent about 2/3 of the total tech staff, where the specialties, the stationary engineers, painters, and so on, are 1/3. And the specialty side will swing a lot more than the 4 primaries. But it's a 2/3 to 1/3 relationship of identifying the 4 primary skills. And generally, I've received a lot of questions in terms of how many HVAC folks should we have? Do we have enough? Do we have too many? And this states that over 100 hospitals, that this is how they rank out, especially looking at some of the high productive case studies and their peers. So this is a pretty reliable number in terms of, do we have the right mix? Do we have enough of the mix? And are they in the right places?
So your number, I'm going back to the, so this number here with the total techs, the staffing, the working techs, this is what they have. This does not take, these numbers though wouldn't take into account your matrix where you were assessing the building itself, the age of the building.
No, this
is independent of that.
This is independent of the age and the condition issues.
Okay. No, so I imagine through the benchmarking process, perhaps you can confirm, can substantiate these numbers, or perhaps argue, well, you might need more HVAC guys versus plumbers.
Right. Once we've sorted through all of the FTEs and focused on who are performing work orders, this is the starting point. And then from this basis, then we'll factor in what's the extra burden dealing with the age issues, the condition issues, and so on. So this is where we'll go into that stage 2 process and and fine tune what their
Okay.
staffing should be. Now, again, this is what the norm is, the industry norm that I have found over many hospitals. And again, as I say, it's pretty consistent. And then if we have a particular client that we want to assess, well, let's see how they compare to what the norm is.
Yeah.
And
Yep.
that helps them start to zone in terms of how many folks do we have and are they in the right places?
Okay.
And then after that, then we again factor in age and building condition issues and any variations to that, any tweaks to that.
Okay, so let's continue on with stage two. Can you've mentioned a couple of times, you've alluded to PMs and CMs. Can we talk a little bit about percentage of PMs versus CMs?
Yep. Preventative maintenance, of course, is the regulatory compliance required maintenance issues that must be addressed on a timely basis. And we're being tracked by those compared to the corrective maintenance, CMs, where again, those are more reactive. The industry goal is to be above 50% on the preventative maintenance. I would say that the majority of the hospitals, of which many are above the 50% threshold, most are in the 30s and 40% PMs compared to the corrective maintenance. And so I think, as we all know, that the more PMs you can do successfully, the less CMs are required.
Hmm.
And then the other issue is that it's probably twice as much, maybe 3 times as much to perform a corrective fix than it is to prevent it from happening.
So did I hear you say that percentage PMs is 35%?
Yeah, up into the 40s. So
Okay.
the majority of my case studies are below the 50% threshold.
Yeah. Yep.
And that's very interesting. Of course, now with our adjusted square footage and FTEs are aligned, then we can get into how much time is spent per work order and what's the cost of that work order. Well, how many work orders per FTE are being performed? Or a lot of folks use how many work orders per 1,000 square feet we use, but the completion rates and the compliance issues become a part of it. If we find that facility staff are overtaxed, they may be falling behind on completion rates or compliance issues. So that's where it starts to become an issue, when some of the work is not being completed effectively.
Yeah. Yeah. I mean, I imagine that starts to create that domino where you are behind and falling behind further.
And that again is where the focus is on the worker techs. They're the ones that have to get the work completed. They're the engine of the department. And work order production is important. How long does it take to perform a work order? And we've got an example here of how we can compare the high performers with the lower performers in some of my research.
All right, so let's look at that, James. What are we looking at here?
This group of hospitals are tier ones, 450 beds plus.
Okay.
And it represents 26 academic and major medical centers, of which there's actually 13 AMCs and 13 major medical centers.
Okay.
What I was able to do after getting everything normalized and all the data input, I determined that of those 26, 8 were what I call the high productive or the high flyers, and the mid-level and the low level. Let's just take a look at the performance. Again, going back to square footage per FTE, the high productive folks were at the 45,000 to 55,000 square feet maintained per tech, per FTE. And then as we go to the mid-level and the low level, the lower level folks in this group were essentially half the production compared to the high performers.
So
let's look at
this hours per work order. I'm going right to your very bottom there. What is that number telling? What is that telling me?
That's telling us that the high production folks are doing a work order in 1.2 hours.
Okay.
And as you go across the board, you see that the low productive are over 2 hours.
Wow. So that's 2 hours for a work order.
That's 2 hours per work order. And that's combined PMs and CMs.
Okay. So work order is defined as PM, CM.
That's correct.
PM
Combined.
or CM. Okay.
And so what's interesting is on the high productive side, the staff are performing twice the level as the low productive side, and they're still able to do work order in a lot less time than the low productive side. And then let's jump into the middle portion there. On a cost per square foot basis, this is total labor and non-labor costs per adjusted square feet again. Once we've adjusted the square feet, we can get a lot of mileage out of what their costs are, broken out labor versus non-labor. And you see that the cost, not only are they performing more square footage, they are doing it on a lower cost basis per square foot, and they're doing each work order at a lot less time.
Yeah.
So does this make the low production folks, good or bad or right or wrong? The point of it is, in most cases, they don't really know how they rank. And if they had a goal, if they had a target, they could start to focus on that target and where they rank. So this is quite telling in terms of what I call the 26 tier ones.
Were you able to determine why it took longer? Could it be, was it, for the low productive, was it because maybe they didn't have as many employees? Were there any causes that you were able to identify behind the why?
A couple of things. I don't feel that there's a clear, definitive target or benchmark as to where should we be, because it's kind of confusing. Again, we know folks are just looking at staff only, but not cost. I think it's important, if you don't know where you are, you don't know where you're going. It's simply a roadmap. Well, we didn't know that we were this low performing. So this gets into best practices of what the high performers are doing. And we'll get into that in a bit in terms of what are some of the types of things. And I think that some of the issues are they have folks that are doing other tasks in addition to maintenance.
And that must be, that's why your work up front, when you're trying to define where does that maintenance tech spend their time, is that must be critical for this.
That's critical for identifying how effective they can be.
Yeah.
And it's unfair to say, well, we've got 4 FTEs doing carpentry, when in fact we only have 2 that are only doing maintenance.
Right.
So That type of a breakdown may not seem like a big deal because they all work for facilities, but if we're going to zero in on benchmarking for the plant ops maintenance side, it's very important to know that.
Exactly. Yeah. I mean, it's kind of like the integrity of your data, right? If it's not defined what the person's doing, then everything's going to be off.
It's all based on data.
Yeah.
And then every campus is going to have a unique element to it in terms of our buildings are older, our buildings are scattered around. We have to drive a great distance to get to the buildings.
Yep.
And based upon a number of different variables, that is discussed and vetted so that they really want to know where they rank. And they may rank poorly. Facility managers want to know how they rank, whether it's good or bad.
Right.
And they want to identify, well, geez, how can we improve upon that? What do we need to do? What are the high flyers doing that we're not doing? How can we learn from them? And in the facility marketplace, there's a lot of discussion between hospitals around the country, and they share a lot, and they ask each other, well, how do you do so and so process? What do you do different than what I do? And so having a clearly defined target of what others are doing, I think, is important. And then
I want to finish. I want to finish with your facility management improvement plan, which I think is kind of what you're talking about there. But before we go, can I ask you a question relative when you in this particular case, when your data when you came up with the low productive, what was the folks who you were dealing with at the local facility, were they surprised by, and I'm assuming based on what you've said, they might have been because they weren't tracking anything, but what was their reaction when they found that they were in that category? Were they surprised? Did they know? What was that reaction?
I would say that they already knew that.
Yeah.
And they had a sense, but they couldn't put their finger on it.
Okay.
And executive management likely knew that, felt that, but they couldn't identify exactly. And so it wasn't that they were surprised so much as for the first time now, we have a definitive target point that we can achieve. So now we know. And in most cases, when it came out poorly, they already knew that that's the way it was going to turn out. But what they really wanted to know is, how can we improve?
Yeah.
What are we not doing? And that leads to the bigger issue of performance improvement. A quick overview. Here's a summary, some of the takeaways and the highlights. Again, the breakdown of the adjusted square foot for working tech. This is how they rank out. The tier ones average out to 39,000 within a range of 33 to 45. The tier twos drop 13% of the square footage that the tier ones can perform. And so we're comparing the proper bed groups with each other. Then the smaller hospitals struggle a bit more, where they can only accomplish about 18 to 25,000 square foot per tech, so about 22. So that's a 28% less square footage maintained than the tier ones can perform. So that's the breakdown of the tier 1, 2, and 3 grouping. We discussed the techs and the 4 primary skill sets and the breakout of the different skill sets and the percentages. Then the other quick note is, of an overall facilities management budget, basically half of that budget is energy, 40 to 60%. And the other half is almost exactly 50%, maintenance, repairs, operations, 40 to 60. Breaking that into MRO spend, we now see another 50% of that is labor. And the non-labor side, purchase services, maintenance, repairs, supplies make up 50%.
Wow.
So it's important to know going in where and what is our total cost? What's the breakdown of that cost? Are we overspending in some of these areas that relate to how the industry is spending?
In that MRO spend, the lower right, the MRO spend here, if the scenario you talked about earlier, you cut 4 employees, but yet you still have to get the work done. Which bucket do the subcontractors fall into? Are they the purchase service?
Purchase services.
Purchase
Right.
service.
So the labor segment there will check down a bit, and that cost would go to the purchase services side.
Yep. Yep.
And again, it's the whole spend.
Right.
It's the total spend.
Yeah.
So it isn't just a matter of, well, we've reduced 10% of our labor mix. We just shifted that cost.
Yeah, it's got to go somewhere.
So that's always been a frustration to facility managers in terms of, we're not really saving anything. You know, I have to get the work done. Yeah, we'll cut 4 staff. I still have to get the work done.
Right.
We're in bigger trouble. So the point of this then, these are the high level benchmarks of we're within the zone of what the industry is doing, or we're not. So if we're not, then we go to the next slide of performance improvement. So I have found these 15 points to be what the high production facilities are doing. And I start out with the data. We have to have good data, accurate data. It needs to be 100%. We can't have some folks reporting work orders and some not. We've got to have everybody input what their performance is and the time to do a particular work order, which gets into my second arrow there, the management of the staff and periodic staff reviews. Are you doing that? Are you able to complete an air handler PM within the prescribed time? Let's say it's an hour and a half. If you're taking 2 hours to do an air handler PM, you know, the point is not to punish you. The point is, okay, we got other folks doing it in an hour, 20 minutes.
Yep.
So let's have you learn from the guys that are doing it efficiently. So that is essential. First of all, knowing what an air handler PM should be. And then the folks that are not achieving that can learn and strive to perform better. Dropping down to number 8, I have found that executive management will sometimes out of the blue, will perform and request a certain project, and it might not even be a maintenance project. They'll expect the maintenance staff to do let's say it's a resurfacing or a fresh up of a certain department. Well, that's actually not maintenance, that's more construction. And so they'll request that maintenance staff do this non-maintenance work, but they do not give them the resources to be able to do that. It is an expectation that they will want the facility folks to do. So that comes into issue more often than not. If you're going to expect something, we need to provide these resources.
Right.
Getting the 4 primary skill sets in the right zone, I think, is very important. And again, that's a pretty consistent number. And if we're not properly aligned in that area, then that is an important task. Number 11, process redesign. There's always time and room to improve the process. So that, of course, gets into a number of areas and KPIs, key performance indicators of how we continually improve. And not only that, how do we measure our improvement? And then finally, number 15, look at the actual cost effectiveness of outsourcing versus hiring in-house. Some folks have a strong in-house employee staffing, and they minimize what they outsource compared to the opposite. Well, neither one of those is right or wrong.
Mm-hmm.
What we come down to is what is the total cost. And in some cases, it's okay to outsource activities if they're competent, reliable, and can be done at a lower expense than we can do in-house. Again, these are just some of the items that if we find ourselves not performing where we want,
Yep.
this list identifies some of the things that we may not be doing. And I'm assuming that they're doing a lot of these already. Like cross-training is becoming more and more popular and so on, all hands on deck approach. Some don't do that. You know, that's in your area. I deal with HVAC. I don't do.
Well, you know, though, you look at some, I mean, and you've just, you've ticked off 6 items on here, but as you were talking, I was just, thinking to myself that the, the lack of skilled employees, the multiple accountabilities that get thrown to the environment of today argues against some of doing these things, not because they're not good to do, but because it's just, it's overwhelming. Like, you can't find the skills. And then because we've cut people, okay, maybe I'm doing more. So it's, in a best case, it's hard to do. Overlay the reality of the market today, it's very difficult. And this is a nice approach to hopefully bring people kind of back to that fundamental.
Right. And again, one cannot expect a facility to perform all of these tasks at the same time. A lot of these will have to be phased in. They acknowledge that they need to be doing a lot of these points, but it needs to be in an orderly process because they've already got work to do.
Right.
And you're telling me I got to do all of this extra stuff on top of my work order schedule.
Yeah.
But this is part of performance improvement. It's what we all have to do in our careers, is we're continuously improving. And it's basically, an all buy-in approach. All the staff have to be agreeable and buy in to our improvement and ensure that we're all getting our activities completed while we improve.
Well, my guest, James Krause from Krause Consulting. James, you have a ton of information. So if you're watching this, we kind of skimmed through. There's lots of great detail, metrics, data that simply can't be shared through 1 hour. But if somebody wanted to either, I mean, your contact information has been there, but where would somebody go for more information if they wanted more information kind of on your benchmarking approach, they wanted to talk to you a little bit more, where would they go?
Well, I'm on LinkedIn, so I can be contacted there. And of course, I would be delighted to chat, talk, email, text, answer questions, of which I'm sure there's quite a few. But through the LinkedIn would be
easiest way. So as we close, and thank you for your time today, what is there anything that we didn't, is there anything we didn't get to that you think is just a kind of a takeaway without them to leave with guests relative to the benchmarking process? I mean, I think we've talked about the big things, but is there anything that we didn't get to that you think is just leave as a little morsel for folks?
Again, I'll reiterate my point of, if we feel that we have to improve, we have to know what our starting point is.
Mhm.
And through some fairly simple data requests and brief discussions, we could get 80% there to determine how are we ranking and what is our goal. But more importantly is, where is our starting point?
Hmm.
How exactly do we compare with our peers in the industry? And that is the essence and the most important point, I think, out there.
Excellent. James Krause, thank you for your time today. I appreciate it.
And enjoyed it. Thank you, Peter.
My pleasure. So as always, thank you for watching this episode on the Healthcare Facilities Network. We will be back with a new episode soon. Thanks for watching. Have a great day.